Hi everyone, welcome back to PICAC WA Brain Health and Dementia webinar. I'm Xu from Fortis Consulting, PICAC Western Australia. Today we will talk about stigma and discrimination against cult people living with dementia, and as a care worker, how to support people and their carers from unfair treatment. Discrimination against dementia is not rare. In most of the cases, people only see the label instead of the person. As a result, they are excluded from many events and even talked to as if they're a child. The stigma of dementia is wide-ranging, not just a person living with dementia, but partners and close relatives also find they lose ability to connect. And in some cultures, the person with dementia is considered to be mad. This stigma and cultural beliefs create problems for the person with dementia as they try to live a normal life. Discrimination against people living with dementia can be caused by cultural biases, misunderstanding, and personal assumptions about dementia due to their lack of understanding of the disease. Dementia Australia has been studying on it over the years to try and dispel some of the myths. However, not all cultures have changed. For example, assumptions like, once there are people diagnosed with dementia, they wouldn't be able to work, participate in social activities, or even make decisions for themselves. Or once people are diagnosed with dementia, they have to be taken care of 24/7. The primary carers, normally their partners, will need to give up their life and work and offer support forever. For some people, it's like being a prisoner. Those untrue assumptions are not only making people living with dementia and their carers scared even more, but also growing the discrimination in our society. As an aged care worker, how can your role make a difference? From a Dementia Australia survey in 2019, 71% of people with dementia and their carers haven't been included in family activities, and 80% of them haven't been invited to social functions. It's often assumed that people with dementia are not able to continue the social activities they used to enjoy, especially those who are in a later stage of dementia. But it's not true. They are still capable to participate in daily activities and be socially connected with other people. Research shows people with dementia and their carers are more likely to feel socially isolated. There is a significant difference in the data that nearly 25% of people with dementia have no friends to talk to about private matters, and over 20% of them have no friends to call on for help, while only around 5% of the general public are facing the same issue. That's why helping people with dementia remaining socially active is so important. Activities are proven to be helpful in maintaining a person's sense of self-worth and give purpose and enjoyment to their day. Not only do we have to think of different ways of engaging their interest when designing activities, but thinking about activities that stimulate all 5 senses. Along the way, dementia will change people's hearing, sight, taste, smell, and the sense of touch. When designing activities, we must consider which senses remain mostly unaffected first, and avoid anything that might confuse the people we care. For example, as the disease progresses, people with dementia may refuse to eat. It's helpful to have someone eating with them, feed them hand over hand, or use plain color plates and bowls with contrasting color placemats. Care workers also have a role to play in working alongside family carers and friends to bring activities into the daily life of a person with dementia. Some friends and family struggle with thinking of things to do with a person, whether at home or when visiting a care home, even if they know the person so well. They may need support from the care staff, such as offering some suggestions for activities and encouraging the person with dementia to become more involved and help them with these activities. Ask them questions, give them choices. Capacities is used to describe the ability of a person to make their own decisions about a number of legal, financial, and healthcare issues. Many people living with dementia still have the capacity to make decisions by themselves. Speaking of effective decision-making, the issue is not whether a person is making a good decision, but whether they're making an informed decision. The Convention on the Rights of Persons with Disabilities affirms that all persons with all types of disabilities, including people living with dementia, must enjoy the same rights as everyone else, including rights to autonomy in decision-making. It's also important to make sure they and their family members can access the same information needed to help them making the right choices, and the needs of the person with dementia are taken into account. Help them to be involved in decision-making and be an advocate for them. People with dementia may have difficulty making some decisions, but they will be able to make other decisions themselves. They may not be able to make the best medical, legal, or financial decisions, but they are able to choose the TV shows they like or the clothes they want to wear. As a care worker, you can assist them maintain their independence and, where necessary, to seek advice from professionals. For many people, seeking a legal guardian or advocate may be required. Resources are available to help them, and these can be found on each state's website. In WA is the Government of Western Australia site for the Public Advocate. Available translator resources can also be found at wa.gov.au. Just need to search the keyword Translated Publications, Office of the Public Advocate. A little support makes a big difference. Think about yourself. When you feel happy or sad, who do you talk to? Your family? Your friends? People with dementia have the exactly same needs, just like everyone else. For some people from culturally and linguistically diverse backgrounds, it's difficult for them to open up, talk about dementia and their fears and concerns with strangers or care workers, and they don't want to talk about it when families visit. The feeling of not being welcomed or included places their mental health and self-esteem at the edge. Help is provided by the Commonwealth Government, and through Dementia Australia, you can access face-to-face, phone, or video counseling services. They're available to people living with dementia and their family carers. It's a great start to gain a better understanding of the impacts of dementia, learn to respond to feelings and mixed emotions, and plan for the future by setting goals and seeking help. However, even though counseling support is a great tool to fight some of the fears of the disease, it wasn't something that culturally and linguistically diverse communities felt they would need. For many, this is often viewed in terms of psychological or psychiatric counseling rather as information provision and support service. As a support worker, try to communicate with your families, showing them the available resources and benefits, and helping them to take the first step to being better informed. Make sure you're informed too and know where to go for help when you see the need. TIS National's free interpreting service is a great tool to make sure that people with dementia can overcome language barriers and communicate with professionals. It's fully funded by the Australian government. Interpreting services can be accessed via phone call, video call, or pre-booked face-to-face counseling. For longer conversations, phone calls are not considered effective for people living with dementia. Instead, video or face-to-face counseling, where people can see each other's face and body language, is much more ideal. Language is not the only challenge we're facing. We should also accommodate their needs and physical conditions. Some people living with dementia have already developed physical conditions, or they're not able to focus over time. Then, consider this when setting up a supportive counseling space, such as keep quiet, use natural colors, minimizing distractions, and bathing in natural light. In our diverse communities, it's up to everyone to bring about change and to learn more about dementia. Support people with dementia to live a full and happy life. We can change, and we can start with removing stigma and discrimination. Seeing the person, but not the badge of dementia. In our next webinar, we will discuss more details about caring for people with dementia, and from there, we will highlight caring for people from culturally and linguistically diverse backgrounds. If you would like more help, PICAC Western Australia has a racism and stigma training course. Reach out to us for your stuff. See you soon.